Okay. Good afternoon, everyone. Welcome to another episode of Chamber Talk with Torrie. Today is going to be a great discussion. I have with me today Good Shepherd Healthcare System CEO Art Matheson and COO, CFO Jonathan Edwards. We're going to discuss exciting next chapters, innovation and investments in our region for healthcare. So welcome, guys. Thanks for being here today.
Thank you.
Yes.
Good being here.
It is going to be a great discussion. We got a lot of questions, a lot of stuff to get through. So this might be one of our longer ones, but I think it's going to be very packed with a lot of information for our community and our viewers today. So let's just get started. And I was reading through this stuff and I didn't even realize this. So let's start talking about Art, you, 20 years in the U.S. Army. And what did that time build for you and shape you to be who you are today and in the civilian world?
Well, after 20 years in the Army, getting out, going in the civilian world, it was a bit of a transition initially. It definitely is different, but has a lot of similarities. I think one thing the Army does well at, and I'm always learning, but it does well at training its leaders, how to lead, and it also does well at helping its leaders and soldiers on how to make decisions, sometimes without all the information that you would like to have. And so one of the words that we actually used earlier today, we had a leader meeting with about 20 of our leaders, is the term bias to action. And that's trying to meet our mission as quickly as possible to be the healthcare organization our communities deserve to have. And we'll talk more about some of the things we've done over the last 2 years.
Yeah. So what brought you to Good Shepherd?
Yeah. So this is my third critical access rural hospital that I've been a CEO of. Okay. And I was in Vermont for approximately 4 years. And then I was actually near my hometown of Portland, Maine. So the other Portland.
Right.
At an organization of about 20,000 employees, Maine Health. So 9 acute care hospitals, 1 behavioral health hospital. And I was brought in to that organization in 2019. COVID hit. The people that brought me in after COVID made the decision to retire. New leadership came in, and they were regionalizing, making some changes to the scope of each of the organizations that fell under the umbrella of Maine Health. And it wasn't necessarily wrong. It just wasn't right for me. The other thing that I saw when I came here is the potential of Good Shepherd. And I knew there was great potential for growth. Honestly, I didn't think that it had the potential that now I realize it has, with a very supportive community and communities, and 2 strong counties that we support, and we're really excited about a lot of the things that we have going on in the future as well.
Yeah, there is a bunch of great work you guys have done, and I look forward to what you guys do in the future as well. So, Jonathan, with that, you have had a couple different roles, and then you moved into your current role. What's that journey look like for you?
Yeah, good question. I started about 20 years ago at Good Shepherd. I was 10 when I started.
I like it.
I've only heard that joke like 30 times. I already started smiling. If you noticed,
you knew it was coming.
Yeah, I knew. I knew it. He does have the baby face, but
I started out as a financial analyst, and so I would say I was kind of in the trenches, and I worked my way up over many different positions over the last 20 or so years. Various management positions in finance, business side of the organization, and in the revenue cycle. The revenue cycle in healthcare is kind of the business side of healthcare. We refer to it as the revenue cycle. And quite a bit of time in business development. And what it allowed me to do was really to get a lot of sort of behind the scenes exposure to how a hospital runs.
All aspects of it.
All aspects.
Yeah.
And so over the course of 20 or so years, you become really intimately involved with each department, each service line that we're doing, and kind of gave me a valuable perspective as I move into this role because I know the organization real well and it's kind of a natural fit for this to take place.
All right. Yeah. When I was talking and learning about your guys' we were talking, you've been there for 20 years. I was like, you've been there for 20 years. You know what I mean? So it's interesting when you finally meet people and get them up in those roles and moving into the role, you really do have an opportunity to bring some good insight into what the potential the Good Shepherd could really have.
Absolutely.
Yeah. So you guys have been in your roles for 2 years. That's exciting. That was a fast 2 years, I have to say. I have to say my first chamber talk was with the CEO 2 times ago. And so now we are here again with Good Shepherd, completely different direction. And I'm excited to that piece. So what have you guys done just in these 2 years?
Well, it's hard to believe, first of all, that it is my 24th month that I've been here. So as you talked about that a few seconds ago, I thought, yeah, it is almost 2 years. And it has been a great 2 years. It has gone by very quickly. And as far as what has actually happened during that time, those 23 months, 24th that we're in now, I go to a part of our mission statement, which talks about care close to home.
Mm-hmm.
And so we take that very, very serious in the sense of if we can bring in the right specialists that make sense in our organization, we can help our patients not have to travel an hour away, 2, 3, 4 hours away.
Mm-hmm.
We won't have every specialty that a big, huge 700-bed medical center has, a tertiary care hospital, as we call it. But we'll have, and we have brought in several over the last 2 years. So I'd say we've done many, many things. But for example, we didn't have cardiology 2 years ago. We didn't have nephrology 2 years ago. We have enhanced many of our specialties with bringing in more providers. For example, orthopedics, as you know, we are at a ribbon cutting.
Yep.
We went down to one orthopedic surgeon early on in my time here, and now we are at 6, covering all modalities except for probably spine. We're not covering orthopedics. That will have to go elsewhere. And so care close to home is really what we're focusing on, and hiring more staff to support all the things that we're doing, the new clinics, and really just growing our team so we can support the healthcare needs of our communities.
Locally,
as much as possible.
Yeah. And Jonathan, on your aspect of it, and I'm just going to let you know, you're very soft-spoken, so you might have to project a little bit more for those viewers online. So from your aspect,
I don't have the main Northeast.
That military, I'm going to deliver my
my outdoor voice inside. Sorry if I'm too loud to those listening.
It's okay. Yeah. So what's your take on the 2 years of your journey?
Well, I think Art. I'd probably point out 2 or 3 things. I sort of have the perspective of being here for a really long time, and for me, it was the community connection over these last 20 or so years. I could really sense the growth opportunity that existed, and it really, to Art's point, it really disappoints us. It really pains us, actually, if someone has to drive long distance to receive care. If we have the ability, whether from a resource or a knowledge standpoint, to provide that care. And so I would say the recruitment has been probably our biggest success in the last couple of years. And Art's being kind of modest. It's about 75 new providers in the last few years across many different specialties, many of which we've never provided previously. So, but I think for me probably, and we have, I think, well over 100 different projects of varying shapes and sizes going on that we've been working on, and things we've accomplished over the last couple of years. But for me, probably the biggest thing is it's helping to develop an organization on a community mindset.
Mm-hmm.
And Art's done a fabulous job with building that team. And as we go out and I oversee recruitment currently for Good Shepherd, and as I interact with a lot of the providers that we sign, there's two or three main things that they are interested in. The first is the vision. What is the vision for the organization? How does that intertwine with the community, and how can the community benefit from this vision? Most providers, if they have any sort of business acumen, they're interested in growth opportunities.
Mm-hmm.
Good Shepherd is unique in the sense that there's a lot of retraction happening in healthcare, particularly in our region.
Yes.
Around us. Good Shepherd is in a very strong growth track, and so those providers are really attracted to the growth mindset. And so the vision is probably the number one thing that Art has brought to the table in that getting the team to coalesce around a shared, vision of what care needs to look like for the community. We've done good things for many years at Good Shepherd, but I think the sometimes we don't know what great looks like because we haven't seen it.
Yeah.
And Art brought a lot of experience from his previous locations of what great could look like, and that for me was very refreshing. And I sort of felt unleashed in a way because I sensed the uniqueness of Good Shepherd over that period of time that I worked here, and I knew that there were a lot of opportunities for growth. And so we have so much going for us right now as an organization. Not only do we have a great vision, but the area is centrally located. The area is growing. There's other facilities in our region that aren't experiencing community growth, and we are experiencing community growth. So much of what we've done over the last couple of years is really catching up to that growth that has been happening for the last 20 years.
Without Good Shepherd, And that does reflect on your guys' added providers. I mean, I feel like I see a press release every other week coming out, like, we got a new provider, and it's just great to see because, like you said, that travel, we have a real large population of underserved people or limited budgeted people where going to Tri-Cities is not an option, where you can get to Hermiston through transportation opportunities and stuff like that. So that's just, great for you guys to, see that need and fill that need. So let's talk about growth. We're talking growth and community partnerships and counties and stuff like that. Your current purchase of the property in Boardman, what's that? What's that going to look like? And what are your guys' thoughts on that?
Yeah, so I'll cover that, but I just wanted to take a step back, if I could, real quick, based off of what Jonathan said. So I think it's important to your question about the Army and what Jonathan was talking about as the vision. And so 18 of my Army years were as a healthcare administrator and leader, doing what I'm doing now. And so I have 28 years of acute hospital experience, starting out leading a clinic to becoming a chief operating officer and a lot of positions in between, and then 3 CEO jobs, this being my third. As far as the vision, I've always said there's nothing more pure as far as healthcare delivery than caring for soldiers, servicemen and women and their families. The next best thing is what we're doing here is rural America, caring for the communities in both of the counties that we support. And there's the reason why I talk about soldiers is when a soldier signs on the dotted line up to the cost of their life, having the opportunity, particularly those coming back from combat, that there's nothing better than being able to provide them the care that they need. That really gets me excited and gets Jonathan excited, providing or having that same type of vision and motivation for our communities here. And so just to give that background of why I do what I do.
Right. And when you say rural, we really are rural. I'll go and talk, and some people are like, oh, we're a rural community and have 30,000, 40,000 people.
Yeah.
we're rural, like, and that's
Yeah.
a completely different landscape on rural out here
Yeah.
too.
Yeah,
Yeah.
it definitely is. But part of that vision, and I counted, this is my 10th hospital, because in the Army you move every 2 or 3 years as an Army leader.
Yes.
And that's a good thing. If you're moving, that means you're doing pretty well.
Right.
And so I had a lot of 2-year assignments to different hospitals. So this is my 10th hospital. And what I know is you can be good regardless of where you are. In rural America, in the big city, it depends on the people in the organization that are providing that care every day. And so that's the mindset that I continue to say to our staff: why not us
Right.
in Hermiston?
Right.
Why can't we be as good as anybody in America? Why not?
We can.
We can. And people are starting to believe. We certainly believe. And when you talk to staff, we hired over the last year approximately 250 staff, both providers and other staff. When you talk to them and tell them that vision, who doesn't want to be part of an organization that wants to do really well
100%.
and is confident that they can do very well?
Yeah, and very progressive.
Yeah,
Yeah.
2 years ago, there were multiple people that told us people just don't want to come to Hermiston.
Right.
They don't want to come to Morrow County. We just can't recruit here. And to Art's point, that we found that to be totally wrong. And one great thing about being in a growth mindset or a growth track that our organization's in, purchasing the 61 acres.
Yeah.
My phone blows up all the time with new providers and new specialties that are interested in what's going on. Because word gets out in the region that, okay, you're independent, you don't have a big, tertiary care medical center or health system you report to. We can generally move pretty quickly. We're very financially stable, and we can get anybody in the country to come here if they share that vision.
Right. That's exciting. So that vision for that 61 acres and what's that look like? I know you guys have done a lot of engagement with local community partners and stuff like that. What's that input look like from this new investment in Boardman?
Well, as you know, and first, before I get into that, thanks for having us, because this is part of that engagement and folks getting to know what we're all about. So we appreciate this time. I want to make sure that those listening understand that we're trying to, at this point, under-promise and over-deliver.
Right.
So it's hard to see end state in exactly what will be on those 61 acres. But this is the vision, and I don't mind talking a little bit of healthcare as far as it relates to what might go on the piece of property that will be Good Shepherd Healthcare System in Boardman. Now, we made the decision, the board, of course, approved it, to buy the entire 61 acres because we wanted, in collaboration with probably a number of people and organizations getting feedback, to have a say in who our neighbors are going to be.
Right.
On Main Street, really important to the community, and we want that property to be something the community and other communities that come to Main Street can be proud of.
Absolutely.
And what that means right now, really don't know, because we still got to do the site master plan and then go from there. But as far as what we're looking to do is some form of a health center. And in the healthcare world, a health center can mean slightly or more than slightly different things. But what we're looking at potentially is a freestanding ED with a helipad. We got a great relationship with Lifelight. They're about ready to base at Good Shepherd, Hermiston. We actually got the structure started, so it's actually looking like they're making progress to the layperson like me, so it's great to see. Ancillary services like lab, rad, space for things like occupational medicine, space for things like potentially urgent care, potentially space for satelliting providers in,
Oh, yeah.
like specialty providers that are unique to Good Shepherd Hermiston. Again, back to care close to home. My dad's 75. I talked to him the other day. I'm going to see him in a couple weeks. And I don't really like him driving long distances.
No.
And neither does he.
Yeah.
And he lives in an area where he can drive a few miles and get the care that he needs. And as much as we can do that for Boardman and the surrounding communities, care close to home, it's not a bad drive. I do the drive often to go swim in the pool here, but I'm 54, and it does get a little sketchy in the wintertime, early in the morning.
Yes, it does.
And so that's really our goal right now. As far as the real specifics of what that building will be, that health center, we're going to have to work out those details in the coming months.
Perfect. What's your take on that?
Like to Art's point, this is likely going to be a multi-phase project, right? And there will be a prioritization of what those services need to start out as and what they need to be in the future. But we don't pretend to know all there is to know about healthcare in Morrow County and in Boardman. We have a pretty good sense, just because we have a lot of patients that come from Morrow County, and about 20% of our business comes from Morrow County. So, but we feel very strongly about the idea that we want to hear from many local stakeholders about what their perspective is. What do they see as the most pressing needs? But certainly there's opportunity for all those services that are offered. I was just reading this morning through our provider list, and we have now 30 robot trained surgeons in various specialties. There's certainly opportunity to bring them here and to satellite in, because long distance to go for an appointment isn't just to Portland or Seattle or something like that. It's even to Tri-Cities, or even from Boardman to Hermiston. And as folks are advancing in age, or even if they have a big family and a lot of little kids, and it's hard to. I'm speaking from personal experience.
Navigating
Yes.
That's tough to do, and so I think we'll have a much better idea in the coming months what specific types of services we'll have there in this sort of phased approach as we do more listening. And today we're doing a lot of talking, but our goal is really to do a lot of listening throughout the community.
But today's conversation is a great conversation to lead into those future conversations, because you're sharing that high level information of what your guys' goals and visions are for that piece of property. And this gives our community and our followers a chance to kind of think about what that is and how that could potentially impact them, and maybe give them some talking points back to you guys when it comes time to share those thoughts too. So
often sneak into the Facebook groups in the Boardman area.
I would sneak. I would not stay.
But there, I don't know which user posted something showing the size of our Hermiston campus versus the size of the property we purchased here. The Hermiston campus is about 38 acres. Which is our flagship campus, and we purchased 61. So obviously, it's unlikely we'll use all of that property for a health center. But to Art's point, we want to be good stewards of that property, good stewards for the community, and providing really good services. And so we're interested, as sort of an anchor point, we're interested in who our neighbors are going to be, so that we can make sure we're providing a top-notch experience for those coming to the property.
Yeah, absolutely. And we appreciate that. And we appreciate you guys being invested in our community and our county, and look forward to seeing what you guys do coming down. So on that, you come across some challenges. We've talked about the great things and stuff. What are some challenges you guys potentially see or had already?
Well, in this project or
overall?
Overall.
A little of both.
Yeah, so as I said earlier, been doing this a long time. So that perspective some have at our organization, and then and then some at any organization. That's the organization that they've worked at most, if not all of their career.
Right, 20 years.
And so I give my perspective is you're always going to have challenges.
Yeah.
It's just how you deal with them and address them. And teamwork is important. Right now, one of the things is we know that the legislators are in session and potential cuts to various areas in healthcare, but potential reform that might make sense in a number of ways. And we're trying to navigate that. And that's always a challenge at times to see what's going to be voted in and what isn't. And so we're paying attention to that. As far as our organization and bias to action, to be quite honest, is we move at a pretty quick pace. Jonathan talked about one of the things that's very interesting to staff looking to come here, to providers, is I report to our board of trustees, 12 board members that are very experienced. And many of them been on the board for several years and understand healthcare delivery. But they have supported us and allowed us to move relatively quickly. But there's, in projects, a lot of moving pieces and a lot of partnerships.
Yes.
And the more partners that you have, sometimes the slower that you go. And at times, not being the most patient people, I'm going to say that to my wife in a good way, not being patient, because when things are delayed, a lot of times certain healthcare is delayed.
Yeah.
And we want to prevent that as much as possible, but some of it you just can't help. And so those are some of a few of the challenges that we've been dealing with. But really overall, it's been a positive 2 years, a lot of good learning, a lot of building our staff to support the various growth in the clinics that we brought in and enhancing other clinics. So we're excited about that.
It is exciting to see that, and going on about like other opportunities. Good Shepherd you have added the new orthopedic building. You just added the pickleball. You touched on Life Flight.
Yep.
What are some other things you guys are looking to expand on for the Good Shepherd system?
Well, to Art's point, when you're, he has a great analogy that he uses. Which we often,
Which one?
Which we often use. And it's called building the plane and flying at the same time. Sometimes, it's easy to sort of get weighed down with making sure something's totally perfect before you make a change or you recruit a new provider or something like that. And what we tend to not wait for perfection. We tend to move at the pace that our community needs us to move at. And sometimes that means that the recruitment that you're doing outpaces your physical space.
Yes.
Right? Now, there's a lot of healthcare organizations out there that would love to have the problem. Oh my gosh, we're growing so quickly, they don't have any space.
Right.
I wouldn't say that's necessarily a huge problem, but what it does force us to do is get creative and think outside the box. And really, that's partly of what led us to this opportunity in Boardman as well. When we saw the quantity of patients that come from Boardman, we knew that this was a pretty good opportunity. And as we, are maximizing our space at our current campus, it could sort of offload potentially some of the volumes that we have coming in. The construction never moves as fast as we'd like it to move.
No.
But we have multiple expansions going on right now in our medical plaza for our surgical services and for our non-primary care, specialty care that we're really excited about. We'll announce this here in the near future, but we just this morning agreed to an agreement with a very highly sought after specialty in our area, and
another one,
and those are things that believe it or not, when people hear that vision, when providers hear that vision, they typically want to move fairly quickly, and so we have to be able to move quickly as well. And sometimes that means a lot of dominoes. Sometimes that means you have to get creative with space. But in business, there's this acronym called a SWOT: strength, weaknesses, opportunities, and threats. Art and I spend the majority of our time every day doing SWOTs on everything, and it's not a formalized SWOT.
I don't think SWOT, but that's what we're doing.
The concept within
it's the concept that we're always looking at what are the strengths, what are the potential threats, what are the weaknesses. What we often find is something that is previously perceived as a major weakness or as a major threat, if looked at from a different perspective, can be a huge opportunity. And some of these Medicaid cuts that are really kind of it's a political football right now, but a lot of what's being discussed embedded within all those risky scenarios that maybe a lot of other hospitals are looking at it that way. We see also a fair amount of opportunity, and in fact, we're actually excited about some of the opportunity that might exist. And so our job, and this is something that Art does a really good job at, and that I'm learning, is our job is to see around the corner. What do we need to be prepared for? What will healthcare look like? What will our situation look like in 3 months, a year, 2 years, 5 years, and be prepared as an organization to face that.
Yeah. So when you talk critical access hospital, what's that look like for Good Shepherd, and how does that make you stand out?
Yeah, great question. Art knows I could go on about this for hours.
Succinct. Yeah, succinct. He starts getting all excited. And,
layman terms.
Yes. Critical access status.
So we can understand.
Okay, that's critical access status is something that is generally applied to really small facilities and rural facilities. And it's been a game changer for most small facilities, because prior to 1997, every healthcare provider, every hospital in America got reimbursed the same way. And it's fee schedule reimbursement. We'll give you X amount of dollars for X procedure or X diagnosis. And what was happening is all these little hospitals were drying up all over the country. And Congress enacted the critical access status, which basically allows smaller facilities who, by the way, can't take advantage of economies of scale when it comes to hiring and a lot of times supplies and so forth. And in rural areas, it's more difficult to recruit staff and it's more expensive. Congress enacted this status to where we will at least, so hospitals that fall into this status will, at least at the time, it was 101 cents on the dollar, 101% of cost. Now it's 99 cents on the dollar. Well, that is a major game changer for a small facility. For example, Good Shepherd has about 37, 38% Medicare. So on 38% of our business, we get 99 cents on the dollar versus a larger organization that gets about 35 to 40 cents on the dollar.
Yeah.
There's two very important caveats, though, in order to maintain that favorable reimbursement status. The first is your annualized average length of stay for an inpatient patient has to be below 96 hours. And the second is a ceiling, a maximum of 25 inpatients. And now we have a lot of people in observation in the hospital. Right. Those are actually two different statuses, inpatient versus observation. You can have endless observation patients, but that's kind of the trade-off. And so Good Shepherd is very, very unique in that we are much larger than a lot of non-critical access hospitals. And there's a science to it, and you have to be very careful on how you administer the program. But that favorable reimbursement gives us the ability to quickly reinvest into our business and stay in the growth track. So this is where the SWOT comes into place. We have to be very careful of what businesses we invest in, what service lines we invest in. So largely, our investment is in the outpatient realm because we have that cap of 25 beds. And what's interesting is, historically, most facilities have sort of been judged in terms of size by how many inpatient beds they've had staffed. We actually, as a 25-bed inpatient critical access hospital, in the aggregate, because of the breadth of our outpatient business, we are actually larger than two facilities to the north and east of us who are non-critical access hospitals and have 75 beds and 110 beds inpatient. So that critical access status is very, very important and very valuable to us. Most people that come to Good Shepherd that are visiting, for example, a new recruit, they're kind of shocked. They're like, well, I just thought this was like a small, rural, little critical access hospital.
Right.
We're not that. And so that being said, we want to maintain that status for as long as we can.
Mm-hmm.
But there are ways to grow as an organization while still maintaining that status. And it's something we think about and analyze all the time.
Right. So as you're talking your leadership roles you guys hold, what are some day-to-day challenges that you guys face in the healthcare world?
Oh, goodness.
I think probably in healthcare, one main thing that can really set you apart, now I'm putting the CFO hat on, one thing that can really set you apart and can be very challenging or can be a great opportunity is the reimbursement side.
Mm-hmm.
And we work very hard at maintaining really high reimbursement. And we do that through two things. We do that through really shrewd negotiation. And sometimes those negotiations go a long time with third-party payers. The second thing is providing high-quality outcomes. When we provide high-quality outcomes in all these new specialties we're doing, we can show the insurance company this is a good investment for us to send our members to Good Shepherd. And reimbursement is always the name of the game, really, when you're running a hospital, because you have to make sure that you have sufficient revenue coming in to cover your expenses.
This is the part that I told you about on Friday, that Jonathan, I've had 3 great CFOs, and they were very good, but he is the best that I've seen at understanding this part of it.
Right.
The other piece that we're constantly talking about is quality, and quality falls into 100 different areas in an organization of our size. But the big thing that we're focusing on right now that I'd like the folks listening to know that we get it is access.
Mm-hmm.
Access to care. And we need to do a better job at when you're calling,
Mm-hmm.
you talk to somebody.
Timely access.
And timely access, because timely access equates to high quality, because if you delay care on a problem you're having, then it gets worse. And then all of a sudden, instead of going to primary care or specialty care, you're an inpatient.
Yes.
And so what we've realized, and I've realized this at previous organizations, is our phone system, literally our phone system, is antiquated and needs to be replaced. And so we've just contracted for a new phone system, and we're going to work hard over the next year to transfer over to that new system and do a better job at answering the phones. And I don't put it on my staff. When you look at staff, you look at staff, and then you look at processes. And this is a process issue. We're not right now, and they haven't had the right tool to do their very best.
Right.
And so we're trying to meet the great staff that we have with great platforms like a new phone system. Right now, in the future, I should say, we want to be able to know how well we're doing answering the phones.
Right.
How many people called? How many people had to wait? How long did they have to wait?
Right.
How many people dropped off because we weren't doing
And
a good
just hung
job
up.
and just hung up?
Yeah.
And we want answer rates in the 95th percentile,
Yeah.
give or take.
Yeah.
Once we get there, I'll be happy. But until then, we're going to continue to work to get there, and then we're going to sustain it.
You know, it sounds so basic to say, well, you got to answer the phones, right? But when you think about the fact that So when I started Good Shepherd 20 years ago, we had about 175 employees.
Mm-hmm.
We just had a meeting this morning where we talked about we're in the neighborhood of 1,700 employees.
Mm-hmm.
So probably one of our biggest challenges, and this speaks to Art's point, is, you know, when you're trying to keep pace, and I'm putting the COO hat on, when you're trying to keep pace with the growth, you have to be able to operationalize the growth that is happening.
Yeah.
And so when we recruit some really great, top-notch Michael Jordan level providers, we have to be able to operationalize the specialty they're providing.
Right.
And that's both a people and a process.
It's probably the most challenging.
Yeah,
That's
the
the biggest
technology, the ever-changing technology and the communication.
Right, and when you now put this in perspective, Good Shepherd has grown nearly 300% in 2 years.
Yes.
Okay, so when you have that amount of growth, what previously you thought might have been sufficient from a phone technology or infrastructure standpoint is no longer sufficient.
No.
And so our job is we have to continually monitor that and go, okay, where do we need to now invest more infrastructure dollars?
Yeah.
Where do we need to get a new phone system in place? More computer servers, more cybersecurity stuff.
Yes.
That's really, really important, and probably the toughest thing that we do on a daily basis is figuring out how to operationalize all of the growth that's taking
All the
place.
growth, yeah. So on that, when you guys are thinking about that, what are those things that really keep you up at night and makes you like keep thinking and keep moving forward?
Well, for me, my wife, and I often, talk about this. I've been married almost 35 years, and my mind never stops going over things. I think a lot of us are like that. For me, ultimately, I think about big things that could happen. First, and it's great that we've got a great CFO and other great people in the finance department. No money, no mission.
Yeah.
Right? And so it's not everything, but it's a lot. And so at the end of the day, we need to make dollars to reinvest in our most important resource, our employees, but in our infrastructure, equipment. Part of the reason why a lot of surgeons have come to Good Shepherd is we have the most modern robots, because that's where it is these days, because the precision of the robots is at such a high level, and it speaks to good outcomes. But a big part of what I'm worrying about, and I heard on a reel several weeks ago where a CEO was saying I should be spending about 50% of my time on the people and the culture of the organization. And so it's never going to be perfect. We're often making sure that we're not letting perfection be the evil of good. But I think we've got a good trajectory on our culture. The thing the Army taught me to do well with my soldiers is you take care of your soldiers, they take care of the mission, and they take care of their leaders. And I think we could always look at other ways to support our people, but we're trying in many different ways to support them as best we can. But culture, this is something that you've probably heard, eat strategy for lunch every day. And if you have a good culture, there's nothing you can't accomplish. And then the last thing, just going back to the 61 acres, President Truman has a quote, and I'm paraphrasing, but he essentially, in the quote, it says, you can do and accomplish amazing things if you don't care who gets the credit. And another thing the Army taught me is it's team first. In the Army Medical Department or the military health system, it's the patients first. They're the nucleus of what we do. And with those that we look to partner with in Morrill County, if they have that same mindset, we're going to do a lot of great things in Boardman and in the county of Morrill County, and continue to do the same things in Umatilla as well.
Throughout our region, I really see you guys have a future and regional impact across everybody here and stuff. You know, and you talk about that culture, that customer service, and not monetizing that customer service, but putting that value of that customer on the services like the phone. Like that's the forefront of, you know, a barrier is that phone system. If I can't get to somebody that wants to talk to me, how can you get that first connection with that customer? So
exactly,
I mean,
it's and the board has heard me talk about it. My team has heard me talk about it because at a previous hospital I was at, after COVID kind of started to die down, we met weekly, and the first thing that we tackled is I looked at our phone answer rate, and we were like 68%, meaning a third of the calls we were not even answering at all. And but right now we're not able to see that what we're able to how many patients are we answering or not. So again, it's not on our staff, it's on a process. And once we can start seeing, and I talk about once you know where you are on the map in the desert, and then you know where you got to go, you're going to get there. Right now we got to figure out, as far as access in our phones, where we are on the map. How many people are calling and getting frustrated because they're waiting a long time, and then we'll hire the staff we need, we'll have the right system in place, and we'll monitor that on a daily basis and adjust. There may be high times, it may be from 10 to noon every day, it seems to be the busiest, so we add 1 or 2 more people to make sure we meet the metrics that are our goals. And so we're excited. I'm really excited about that because I saw what it did at my previous hospital, and it was huge. And I hope it has the same impact here.
Yeah, that's the upfront stuff. But at the end of the day, the post-op stuff, like after people leave, that follow-up, I've heard of huge compliments to your guys' aspects of the follow-up. Like they actually called me back. They actually called and said, how are you doing? You know, and that goes a long ways too, that front, but at the end of the day too, and knowing that you were just not a service and in and out the door, and you were actually a person that had.
Yeah, there's something to be said about rural hospitals where you buy a home, most people buy a home nearby, they raise their family. Their spouse, significant other has a job somewhere in the area. It's not too hard as a leader, in my opinion, to motivate a team like we have, because they're proud of their organization. And nobody comes to work at Good Shepherd saying, I want to fail, or I don't want to do a good job. This is their community, and it's pretty easy to motivate them to want to be great. And we've got great providers, great physicians, and great staff. And I think, that's why you're hearing the things that you're hearing.
Absolutely. So in that, anything else you guys would like to share with our audience watching today, or just in closing thoughts?
Just a couple thoughts. It used to be that in rural areas like ours, the larger hospitals, larger health systems would satellite into our areas. Coming out of COVID, when costs across the board, inflationary problems went through the roof, that no longer became financially feasible for them to do. So if we decided, if they're pulling out, we're taking advantage of this window of opportunity to provide this care. So if there's something that keeps us up at night, it's are we moving quickly enough to meet the need of our community while we have this window of opportunity before us. And one thing I've appreciated about Art and his leadership is communicating proactively in a very politicized climate. There's one of my maybe pet peeves is unless you're developing your own narrative or you're driving the communication, a narrative will be developed for you. And often that narrative is completely wrong. And so we want to proactively work with all of our patients in the Morrow County area, particularly with our property purchase here, in driving the narrative about what we want for the community, right?
Yeah.
And that's a very proactive approach instead of a reactive approach, waiting for somebody else to take the reins and do something. We feel like we need to take advantage of this window to continue to provide the care to our community. And it's not just Hermiston, it's Boardman, it's Morrow County, it's a big portion of Umatilla County. And folks are taking note from throughout the region that this is the place to be.
Just a couple of things. First, over the last several months, I've gotten some feedback, and it may be very limited, but I think this would be a good forum. There have been some name changes over the last several years at Good Shepherd,
Yes.
and there are some questions of are we still a hospital?
Right.
And the answer is absolutely, as we talked about earlier. But healthcare system, I've been part of 3, has more to it than just a hospital.
Yes.
For example, we have home health and hospice. We have a medical group which is made up of all of our outpatient or majority of outpatient practices. When we build the health center or whatever we end up calling it here, it will be the campus, the Boardman campus, or something similar to that. And so I want to make sure that folks understand that we are a hospital, but we have many other support services to include, for example, wellness.
Yes.
And the family wellness day that we had the most attendees in our history, over 700. So we got a great wellness team. I could go on and on, but I think it's really important that folks know they have a hospital and a healthcare system that's growing here in the region. And then lastly, as far as the partnership in the 61 acres, we want to be collaborative. We want to be more on a listening tour and find out people's perspective. To Jonathan's point earlier, we've been doing this a long time, 48 years combined in healthcare, but we don't have all the answers. And certainly we don't live in this community. And I'm sure there's some unique things that we're not privy to that would help us as we move forward. So we're willing to talk to anybody and to sit down and hear their thoughts. We can do it in person, obviously, or virtually, but we want to hear people's thoughts and then move as quickly as possible that it makes sense to do our site plan and then start getting things moving with construction.
Perfect. That's great. Well, thank you guys. Thank you for joining me today. A great discussion, and thank you for everything you guys are doing in our area. I mean, it's making an impact, and it's shown on your guys' success and growth. So just thank you for that effort. To our viewers today, thank you for joining us. And if you want to see this discussion again, you can follow it on our Facebook page. We'll be sharing it to the Good Shepherd's page. And also you can find it later on the Boardman Chamber's YouTube channel to watch it anytime you would like. So that being said, thank you again, and I'll see you next time on Chamber Talk with Torrie. Thank you guys.